before we begin with our discussants, you can put your questions in the chat and we'll try to get to them. While I'm waiting for the first question, I have a question for you. Well, actually, we'll take the question from the chat from Rada Anderson. Which peer-reviewed journals do you suggest for those of us researching social determinants of health and PGHD in relation to physical, occupational, and speech therapy?
That's a great question. Certainly the American Journal of Public Health, I think, has been publishing on social determinants for quite a while. I don't know how many of you are members of the American Public Health Association, but that is very widely read, very well respected. Health Affairs also has been publishing quite a bit more on social determinants lately. And the editor of Health Affairs, Alan Weil, made a statement within the past 6 months, I think, about Health Affairs Journal, which is more policy oriented, kind of moving in the direction of understanding social determinants. There are also, I think, for clinical journals, many of them are really still disease specific. But if you are interested in a clinical audience for informatics work, the journal Applied Clinical Informatics, pardon me, I'm an associate editor for that journal, and I see a lot of really wonderful cross-cutting work. I think that there are physical therapists who publish there. And that those would be the ones where I would think you would find the most receptive audiences when you start talking about, one more, Journal of Medical, JMIR, Journal of Medical Informatics Research, also is a little older than Applied Clinical Informatics. ACI is an official journal of the American Medical Informatics Association, but JMIR has been publishing for 20 years or so on the telehealth spectrum. So I think clinically, those are the ones that I would suggest.
Great. Thank you.
Thank you.
So you've given a really nice diagram of the different ways that a stakeholder engagement can be used in learning health systems research. And I'm wondering if you have some thoughts about where clinical researchers and health system researchers can get additional training in this area.
Wow, that's a really challenging question, because I think that it's just really beginning to emerge. As you know, Linda, in terms of learning health systems, a lot of this work is just beginning to be offered in continuing education courses. So this is, I think a lot of this still is really very much disease or condition focused. So the other thing I should say, I don't really have a great answer, but I wonder if Coursera or some of the online courses where it's faster to get the content approved from a curriculum to get it online. That's something that I think it's a great question I'd like to look into more. Linda, maybe you have an answer for that.
Well, we do have, I mean, hopefully we're developing
Right.
additional resources, but I think, there's a hunger for additional training and certainly to be able to do this successfully. And I think we'll be hearing more examples of different types of research, requires some amount of expertise. And many of us, I think, learn on the go and learn by doing. So here's a question from Ann Thackeray. Do you have recommendations on how to include stakeholder feedback in manuscripts in which stakeholders provide interpretation of results?
Well, I think that there are a lot of ways to answer that question. One way is that there are actually more consumers or patients who are beginning to be familiar with research because of PCORI, the influence of PCORI in emphasizing stakeholder engagement. More researchers and research teams have put patients and caregivers in the driver's seat in terms of their advisory group. So going upstream, not just waiting until you have results, but putting that perspective in the research development process. So you ask questions that are going to be meaningful. It's a lot easier to interpret if they're involved and engaged from the beginning. But I think that, again, it really depends on where you are. If you are in a hospital that has some kind of a patient experience council, for example. They're called different things in different places. But those folks tend to be people who are a little bit farther out from their own treatment experience often. They're a caregiver on behalf of someone else, or they become what's called a professional patient, in that they are often invited to talk about the patient perspective in terms of medical education and training. So there are a lot of ways to take advantage of the resources that are right in your own institutions. And those groups are not always as well known as you might think, but I would suggest start where you are and see who might be available. And also think about moving upstream to put advisors in the process earlier. And I see that Carolyn Peterson is making a comment. Thank you, Carolyn.
Yes, there was a question that I missed. We have just like one more minute, but from Michael Degati about in optimizing and restructuring clinical documentation in the EHR, what
Mhm.
set of standardized data elements covering PGDE and SDOH ought to be considered for inclusion in clinical documentation? And I believe that Carol's response was related to that.
Mhm.
Um,
Thank you, Carolyn. She's really the expert on that. I do want to say that with regard to the SDOH data, the social determinants of health, there is a group called the Gravity Project, and I sit on their strategic advisory council. And what they're doing, it's an open community nationally where people are working on all of the different social determinants: housing, transportation, food insecurity, and so forth, and coming up with standardized codes that are going through an HL7 standards process to be adopted. So stay tuned. That work is very exciting, very inclusive, and it's open to the public.